Hello everybody, this is Dr. Francis Elwart with the God Health Experience with Total Health Systems. This is our third podcast. Appreciate you watching it so far. Our guest today is Dr. Andrew Bajaj. Welcome, Doc.
Thanks, Doc.
He's been working in Metro Detroit for the past 11, almost 12 years now. He's been our top doc for the past 8 years. He works in our Clinton Township office currently. And he is also, unfortunately for me, as a Michigan fan, a big Spartan fan and is a graduate of MSU since 2009. Again, welcome, Doc.
Thanks, Doc. Appreciate being here.
Today, appreciate it. Thank you very much. Today we're going to talk about sciatica and basically how to treat it at home for the most part. I've seen a lot of sciatica. I've been doing this almost 21 years. Sciatica is probably one of the most painful conditions we have. As we talked before the podcast, I pretty much have had every condition that patients come in here with to our offices as chiropractors. One thing I never had has been sciatic pain. And I'm going to let Dr. Bajaj kind of explain the condition a little bit. And go ahead, Doc. I mean, you've seen a lot of sciatica.
Oh yeah,
through the year.
Yeah. It's pretty common condition a lot of us deal with, whether it would be chiropractors as we are, or our physical therapists, or even our massage therapists even see it. You know, it's probably one of the most common things we see is just how it presents. You know, sciatic pain, as a lot of people may or may not know, it's the largest nerve in your body, coming from your buttocks all the way to your foot. How a patient comes in really depends, right? It depends on what they're doing. It could be anything from their job as bending, twisting, lifting. A lot of people in the manual labor, whether it be in a factory, whether it be something else, or even you could be at home, like working in the yard, chopping some lumber, doing some yard work, and that can even cause it over time. You know, but usually the way it presents is, as we like to say, the textbook is you're going down the back of your buttocks, all the way into the back of your leg, into your knee, into your calf, into your foot, into your toes. That's how it's textbook, but that's not how patients come in. You know, if you think about it, sometimes they come in and it's like, oh, I did this, I was sitting too long, I was driving for the last 3 hours to a place up north, or we went to a family vacation, and and I have pain in my buttocks, so it could present like that. Some patients walk in and you're like, you know what? I have pain in my back, but I also have it in the calf. So it kind of indicates where we should start looking at.
Sometimes it almost just crosses over pain, no pain, and then just continues as pain. And again, I mean, the textbook is one thing, but I tell everybody when they come in the office, everybody's body is different.
Correct.
Everybody's got different genetics, everybody's got different jobs, different lifestyles, different body shapes, different nutrition, so on and so forth. So, and that's one of the things we were just discussing is it comes across as pain in the low back typically, and it runs down the back of the leg. Sometimes it's asymptomatic, meaning there's no symptoms in the lower back, and then it just goes right to the leg, which I've seen a couple times this week already.
Yeah, I've seen that too. Honestly, probably in the last few years, that is a little rare for me to see. Most of my patients typically have some component in their back, whether it be, because it could be also coming from their sacroiliac, their SI joint, into the buttocks, from that portion of the back. But I think in the last month, I had probably one patient where it was just their leg. And I had to explain to him, like, look, it's your sciatic nerve, it's coming from your back, even though it's asymptomatic there, here's what's going on. And that kind of leads to like what causes it, like the risk factors and all.
Right, so let's talk about that. So obviously we talked about just this joint misalignment, inflammation, swelling, that's obviously very common.
Right.
If you're a little younger and don't have any disc issues, when I say disc issues, I'm talking about degenerative changes which are arthritic, or which is a narrow disc as most people might know it, or it's even some kind of disc disorder as far as a bulge, herniation, so on and so forth.
Right.
Right?
Yeah, correct. It's typically, and usually what that tells us is that disc is causing either pressure on the nerve directly pinching it off, or causing stenosis, which is basically pressure in the spinal canal, not just on the nerve.
Right, where the disc kind of travels backwards, which is typically how a disc goes normally.
Right.
Touches up on the spinal cord, and sometimes that's where you get what we call bilateral, meaning both legs are an issue.
Right.
Correct?
Correct.
Go ahead.
Okay. But yeah, correct. It's typically that, and even with its being bilateral, some patients still sense it more on one side than the other, and that's really, I guess, based off of what may have caused it, or may lead to, like, some people favor a side.
Right.
Like I can tell you, if I'm standing waiting for something in line somewhere, I'm probably going to put more pressure on my right foot. It's just I have a tendency to lean that, and if I'm doing that for several hours, especially if I was standing at a job doing that, I'm probably going to irritate those joints.
Absolutely. Let's talk about the piriformis. That's one of the big things that we see. Patient comes in, presents, and I'm going to use some big terms, the erector spinae muscles along the side of the spine, including what's called the quadratus lumborum,
Correct.
usually one side, unilateral or bilateral, both sides, depending on where the sciatic pain is and the low back pain is. But those are really tight. But then there's a muscle in the buttocks underneath all the gluteal muscles, right on top of the sciatic nerve, that becomes majorly spastic, and it's just very hard as a practitioner, as a provider. When I feel it, it just doesn't feel right. It feels almost like a stick in there.
Correct, yeah.
Right?
It typically feels like a stick. Sometimes people like to say they have knots throughout it because it depends, again, what they're doing. Like, again, people who are more manual labor are likely to see that more often just because of the repetitiveness of it. But then even someone who's sitting at a desk for hours at end, you're sitting at a desk. So you're like, even right now, as we're sitting here, if we were sitting here probably 3 hours, we probably would start feeling that area especially.
Absolutely.
Right. But then again, people who are also bending and twisting and lifting, if they're doing proper hip motion, they're not going to feel it in that area. They're going to actually probably feel it in their calf, or a little bit in their ankle, or even a little bit in the front, a little bit radiating to the shin.
And that's the most important thing. I mean, movement's key. And that's one thing we don't do in today's day and age, and as human beings in 2024, is actually move, right?
Correct.
Like they talked about, it's usually people that do more physical jobs, things misalign a lot easier, or you just sit at a desk all day and mouse, usually with your right arm. That's where you get shoulder problems too. And the disc just doesn't move, it starts to degenerate, and then we end up in our office doing chiropractic, physical therapy, medicine, massage, whatever else is necessary for them to get better, correct?
Correct.
Right. What kind of things can we do about it, other than obviously the obvious, like I just talked about, chiropractic, physical therapy, general medicine, which it helps.
Right. I mean, even with general medicine, as we've talked about, some people need that extra oomph with an injection. But again, it relates back to, as we were talking about earlier, whether there's stenosis or a disc, because those are the patients who may need that extra help from a medical provider.
Absolutely.
Right.
So as far as let's talk about stretches. I mean, at home, that's what we're talking about today.
Right.
What can you do?
I mean, there's several stretches you can do. It all relates to, as we talked about, where is it? Is it more the calf, the shin, the ankle? Is it more the piriformis? One of the more common ones, because a lot of the patients who come with sciatica, there is a hip flexor or piriformis component to it.
Right
So
in the buttocks.
Buttocks, yeah.
Correct.
So we'd really want to stretch that buttocks area too, for those who have the main component being the piriformis. That'd be one stretch doing that. And as one of our colleagues will show you at the end of our video today,
Correct.
kind of demonstrate how that is done. But that is one of the more common ones I give to the patient if that's one of the factors tied into it. The other is our hip flexors. We're standing all day, and these muscles always tighten up. So over time, we're going to want to stretch those out.
Correct.
Right? That's the other component. And then another one I like to give patients is kind of the hamstring, because it can also be the hamstring, and you get a little bit in the calf. And there are many ways to do that. One way people to do is lay on their back and strap themselves with a little belt to help with that, or you push against the wall, or even standing and putting their foot on a small little stool or chair to stretch that out.
Any which way works, correct?
Right, correct.
It just depends on what you're able to do physically with other problems you might have.
Correct.
Yeah, it's a good thing, definitely. And obviously, if things, here's a problem too. If things are not progressing and not doing well, we're not afraid to refer out to other providers, a pain doctor, an orthopedic, because sometimes, unfortunately, people just don't get better.
Correct.
And that's any profession, any discipline. So that's definitely a thing that we look at, because we want our patients to get better, whether we can help them or somebody else can help them. Correct?
Correct.
Yeah, definitely. Any other thoughts on sciatica, Doc?
No, not that I can think of.
I appreciate your time. Thank you very much for coming. This is Dr. Andrew Bajaj. I'm Dr. Francis Elwart. At the end of this video, we're going to have one of our other chiropractors who's currently in our Centerline office, Dr. Ames, show these stretches that Dr. Bajaj talked about. And hopefully, if you have any sciatic pain, these stretches will help you. If not, we're always here at Total Health Systems to help you out, get better, and stay healthy, because you deserve it. Thank you, everybody. Have a good one. Take care of yourselves. God bless.
Single knee to chest stretch. For this stretch, you're going to be laying on your back with your feet flat on the ground and your legs in hook lying position. You're going to bring your knee up to your chest and pull inward. You should feel a good stretch from your buttocks through your lower back, and we'll have you hold this one for 20 seconds, repeating twice on both sides. Double knee to chest stretch. For this stretch, you'll be laying on your back with your feet flat on the ground and your legs in hook lying position. You're going to grab both of your knees and bring them up to your chest. For this stretch, you'll feel it in your lower back, and you should hold it for 20 seconds and repeat twice. Hip flexor stretch. For this stretch, you'll go down onto one knee, keeping your knees nice and square. I suggest putting something soft underneath the knee that's on the ground. From here, you'll lean forward, making sure that your hip is engaged, and you should feel a stretch along the front portion of that hip. You'll hold this for 20 seconds and repeat twice on both sides. Piriformis stretch. For this stretch, you'll be taking your leg, crossing it over your other leg like so, and then taking the opposite arm and crossing it over that leg. So you should feel a good stretch along the glute right in that piriformis. You'll hold this stretch for 20 seconds and repeat twice on both legs. Hamstring stretch. For this stretch, you'll utilize a stool or bench. You'll let your leg up on the stool, keeping your leg straight and the knee locked. Lean forward slightly, and you should feel a stretch along the hamstring. For this stretch, you'll hold for 20 seconds and repeat it twice on both legs.